This video will cover sickle cell disease, which is a hemoglobinopathy disease affecting red blood cells. That's one large water bottle, and directly underneath it, there's some red liquid and yellow liquid. This should help us remember that severe hemolysis can be seen in sickle cell disease, and that hydroxyurea, which increases fetal hemoglobin, is used to treat these patients. Fetal hemoglobin helps prevent hemoglobin S from polymerizing. Altogether, the yellow liquid reminds us of urine, which sounds like the urea part of hydroxyurea. The large water bottle represents the hydroxy part of hydroxyurea. The baby represents the fact that hydroxyurea increases fetal hemoglobin. Bear with me on this one. Did you really want to see a fetus on this image? This scene must be set in recent times because that looks like an iPad kid to me. But wait, the iPad seems to be broken and it says B19 on the screen. The broken iPad represents viral infections, which can cause splenic sequestration and sickle cell crises in these individuals. Just like how viruses can break computers. Get it? And of course, the B19 on the screen represents parvovirus B19, a common culprit which can even cause aplastic anemia by arresting erythropoiesis in these patients. Just like in the sickle cell trait video, we see a metallic bean on the right side of the image. This represents renal medullary carcinoma, which is also associated with sickle cell disease and tends to occur more often on the right kidney. In case you haven't watched that video, medullary sounds like metal. If you do any cooking, you'll know that the fish here looks like salmon. But look, there's some bone right next to it. This represents that salmonella can cause osteomyelitis in these individuals. There's one more bug associated with this disease for us to remember. See the striped shirt the character is wearing? And you see how windy it is? These two combined should remind us that strep pneumo is the most common organism that causes infections in these patients. Stripes sounds like strep, and the windy image will remind us of pneumo, or lungs. Lastly, the banner that says 80% hemoglobin S is a reminder that these patients will usually show more than 80% of their hemoglobin as being hemoglobin S.